Community and home-based care service is one of the critical care and support services provided to people living with HIV in Nepal. CHBC teams provide basic health services, social, emotional, and spiritual support, reinforcing the concept of positive living and reducing stigma and discrimination in the community. Lakshmi Pariyar, mother of 4, is a CHBC worker for Gangotri, an ASHA Project local NGO partner working in Acham, one of the most rural districts of Nepal. She lost her husband to AIDS while he was working in India. She is currently on antiretroviral drugs and she is healthy now. She says, "Thanks to the CHBC program, I have also been availing the services." Like other CHBC workers, Lakshmi visits fellow people living with HIV and AIDS in remote areas of Acham district. Lakshmi shares, "I love serving the infected like myself." Bimala Thapa is a CHBC team leader at Gangotri, Acham. Every day, she starts by completing her household chores and then travels to nearby villages to serve the PLHA. Lakshmi assists Bimala as a CHBC team member. Every morning, they meet to plan their daily activities and replenish their CHBC kit. They then head out to the field. Bimala and Lakshmi endure hours of walking on rough terrain to provide door-to-door services to PLHA. En route to CHBC clients' homes, they make frequent stops to talk about HIV and AIDS with community members to help reduce HIV-related stigma and discrimination in local communities. CHBC workers have become familiar faces in the villages and are warmly greeted by community members. Jupri was affected with HIV by her late husband Prem BK. 2 of her 5 children are also HIV affected. After her husband's demise, the responsibility of paying off her husband's medical bills, as well as supporting the family's livelihood, fell on her shoulders. Poverty and lack of savings left her with no alternative but to work for the well-being of her children, but her fragile health continues to hinder a steady income. Her eldest son and daughter are currently working in India to help pay off the debt and support the family. The CHBC team came to our village and treated my daughter and myself. Both of us are currently on ART and our CD4 count has increased significantly, says Jupri. Jupri has gained the strength to start working again. Now I can easily collect firewood and animal fodder. Gangotri has given us a new life and a glimmer of hope for the future. If the CHBC program ends, thousands of PLHA will succumb to an untimely and painful death, says Jupri. After a long day's work of serving the PLHA in their own homes, the CHBC team heads home. Tomorrow, they start all over again, serving other PLHA in Acham.